Hello, good evening. First, hundreds of patients have died with COVID after contracting the virus in southeast hospitals. An investigation by this programme can reveal. The figures show that at one Sussex hospital trust, more than a third of those who died with the virus are likely to have caught it on wards. A whistleblower who works at the trust believes COVID spread rapidly amongst patients because of lax infection control. Well, at least 750 people died with COVID after contracting the virus in our hospitals. The NHS definition states anyone who tests negative on arrival but positive after eight days probably caught COVID in hospital, and those who test positive after 15 days definitely caught the virus in hospital. Our special correspondent Colin Campbell has this report.
It's a health crisis that's tested hospitals to the limit.
I think it was an enormous challenge to face for any healthcare setting.
Many trusts and hospitals were, if not overwhelmed, close to being overwhelmed.
But some believe the death toll could have been lower.
When we started off with the first patient confirmed COVID, a week later we had like 3 or 4. The patients that didn't have it, they got it inside the ward, obviously.
Armin Rood cleaned wards at the Royal Sussex Hospital in Brighton throughout the first wave. He's also a whistleblower, one of 3 hospital workers I've spoken to who say they were instructed to cross between red COVID-infected wards to so-called safe green wards on a daily basis.
In the beginning, we didn't have the right masks. There is the possibility that we were already infected, and by moving from bed space to bed space, we would be actually, without knowing, be a possible risk of transmission to other patients.
Did you ever suspect that this movement, your personal movement from infected to non-infected areas, could potentially be infecting people?
Yes, because we had these problems before when we had norovirus and C. diff on the ward.
Figures we've gained from Brighton and Sussex University Trust show during the pandemic 106 patients definitely caught COVID, then died with it. 67 people probably contracted it and died with the disease. It means more than a third of the total who died with the virus at the Sussex Trust are likely to have contracted it in hospital.
The figures seem to show that a much higher rate of people contracted COVID here and then died here than other hospitals in the region or other similar hospitals in the region. And that is deeply concerning.
In a statement, the Trust say hospital infection rates reflect almost exactly the levels of COVID transmission in the community. Since November, staff have routinely made use of asymptomatic test kits made available by the government, adding they've strengthened infection prevention and control in line with national standards. Armin stopped cleaning at the Royal Sussex in May 2020 after he fell seriously ill himself with COVID. By the time the second wave hit, hospitals knew what additional measures they could take to better protect patients.
The extent to which those additional measures were put in will have varied across the country. So what we're seeing is quite a variety of rates across different hospitals, and so big that there needs to be some sort of explanation as to why that has occurred.
Bags of hazardous clinical waste left in a corridor. Armin claims he has documented evidence of safety breaches reflecting poor standards of infection control.
When we have infectious waste or waste coming out of COVID red zones, it needs to be disposed and stored properly.
He says enhanced cleaning protocols were not followed on the elderly care wards where he worked. Patient beds spaced less than 2 meters apart. Cleaning staff not provided adequate PPE.
Masks have been shared. Masks have been swapped around from shift to shift. They've been cleaned. And that's going to have led to the spread of COVID.
The Trust say at no stage did they advocate the washing, reuse or sharing of masks, and they're satisfied adequate, appropriate PPE was provided. But other staff I've spoken to have raised similar concerns and say they were asked to clean communal areas with just water and microfiber cloths. Figures we've gained show at least 751 people are likely to have caught COVID in hospitals in the southeast and died with the virus.
2 hospital trusts refused to provide us with the number of patients who contracted COVID in their hospitals and died with the virus. East Sussex Healthcare Trust told us they weren't going to release the data to us as they were in the process of reviewing it. Dartford and Gravesham NHS Trusts told us they feared the release of the figures could risk eroding public confidence in the trust, but also put prospective future patients at harm.
And I felt then that he wouldn't make it.
Dick Lukehurst was taken to the William Harvey in Ashford last year after fracturing his hip. He tested negative on arrival, but 5 days later tested positive to COVID. The NHS say it is therefore technically unclear where he contracted it.
He must have caught it in hospital. And for the consultant to say that as well, I can't think otherwise.
He was free of the virus when he died with pneumonia. COVID is listed on his death certificate, and his wife certainly believes it didn't help.
I do feel that something went terribly wrong.
Some say the hospital-acquired COVID death rate figures need careful consideration, and that it is the age of hospitals and the number and types of patients they serve which can have the biggest impact on infection control.
I don't think just because a particular hospital or trust has a high rate means to say that they are necessarily, quote, bad at doing infection control. They may be doing their utmost, and as well as an adjoining trust who appears to have much better figures.
University Hospitals Sussex say they're satisfied appropriate steps were taken to protect the safety of staff and patients. Armin and others I've spoken to who work for the trust believe more could have been done.
If we look at the figures, over 125,000 people, lovely patients that have lost their life. Maybe I can give them a platform that we start looking a bit better after them and make an effort at least to try to protect them better in the future.
That was Colin Campbell reporting.